actually get started with like a little video that is actually really popular when I was in grad school. Let me see if I can find it.
Hello, Professor. I would like to talk about my future. I want to be like you and get a PhD in clinical psychology.
Why do you want a PhD in clinical psychology?
My friends say that I give really good advice and I like to help people and tell them what they are doing wrong.
You can still give advice and tell people what they are doing wrong without a PhD in clinical psychology.
I want a PhD. I think it's cool that people will call me doctor.
Who will call you doctor?
My patients will call me doctor.
Your patients will call you by your first name and will not even know that you have a PhD. They will be confused that you are a doctor who cannot prescribe them psychiatric medication.
My friends will call me doctor.
Your friends will laugh at you if you ask them to call you doctor.
My family will be proud of me and call me doctor.
Your mother will cry and ask you why you did not become a real doctor.
I need to feel proud of myself and I will call myself doctor.
If you need a PhD to be proud of yourself, you should go to a therapist because you have low self-esteem. Seeing a therapist will also be cheaper than going to graduate school.
As a clinical psychologist, I will make a lot of money in private practice. I will also make more money than therapists with their master's degrees.
You will have to spend your money on office space, malpractice insurance, licensure fees, continuing education credits, advertising, dues to the American Psychological Association, dues to your state psychological association, and dues to your county psychological association. You will also have to pay your student loans. You will have $100,000 more in loans than a therapist with their master's degree and only make $10 more an hour. Calculating your student loans, student loan interest, and delay in beginning your career as compared to someone with their master's degree, you will actually make $15 less an hour.
I will just see more patients so I can pay my higher student loans and one day buy my dream house.
Your student loan payments are based upon a percentage of your current income, so the more money you make, the more you will have to pay back every month. You will not be able to buy your dream house because you will have student loans the size of a mortgage.
My husband can buy our dream house.
Do you have a boyfriend now?
No, I do not. Why do you want to know if I have a boyfriend?
If you do not have a boyfriend now, you will not find a boyfriend if you go to a PhD program in clinical psychology.
I don't understand. I can date a nice sensitive man in my program who also wants to be a clinical psychologist.
There will be a few.
Very funny. Mostly, there's a lot of misinformation in that, but one of the take-home points I have when I'm talking to students about this is like, if you're just going, you're like, I have to do a PhD because I want people to call me doctor. Like, I want to be a doctor. Like, not a good enough reason, right? So that's part of the reason I try and talk about this is like, what are the spectrum? What are your options? I do take into account like what kind of options lead to what kind of debt, because I do think that's really important to think about what is your earning potential and what kind of debt might you come out with after going through, whatever the next step would be. And so that's kind of what we're looking at today. But I always like the part that's like, not your friends will laugh at you if you ask them to call you doctor. Your mother will cry and ask, why did you not become a real doctor? Okay, so let's get going. So I like to do this because I would tell you a little bit about my path and how I ended up where I am, because I like to chat with you guys because I was in your shoes at one point. So I was a psych major here at U of M. I studied abroad most of my junior year at Oxford, and that was like a really cool experience for me. I went abroad thinking like I wanted to be a clinician and a full-time clinician, and I wanted my PhD, so I wanted people to call me doctor, and I wanted to see clients and help people. But I was like, I don't want to do research. I don't like research. It sounds boring and icky and like, ugh. And when I went to Oxford, I got like a really good opportunity to work more one-on-one with different researchers, and I realized like I actually love scientific thought. I love the idea of asking questions and thinking about, like, what are we missing and how might we treat this stuff differently and how do we add to our current knowledge base about what's out there. And I felt like if I was doing full-time clinical work and I was seeing phenomena of questions and I wasn't able to, like, do research on that I would drive myself a little insane personally. So that's when, like, the idea of, like, okay, I want to do some clinical work and I want to see people and help their lives get better, but I also want to understand and try and, understand and improve the way we know what is driving these issues to help inform how we might treat them better. So that's when research kind of first came as a possibility to me. I actually didn't do any research labs as an undergrad here, which I would not recommend. So I would recommend, if you have the opportunity to get involved in psychological research, that's a really great thing to do as an undergrad. And I'll talk more about why that is. If you do not, if you're like a senior and you're like, well, time is out and, like, I never got, like, a psych research experience, that's fine. I didn't have one and I ended up here, so yay. So it's not the end of the world, but if you're freshman, sophomore, junior, and you're thinking about what are some things I might need to set me up to have as many doors open to me as possible, trying to get involved in a psych research lab is a really good one, and I'll talk to you about ways to do that. After that, after I graduated a semester early because I hate being cold and I swore I was never going to live anywhere ever again. So haha on me. And so I moved out to San Francisco kind of on a whim with a bunch of friends, and I didn't have a job lined up. My parents were dying. So I moved out there. I was a cocktail waitress to pay the bills. Because with a bachelor's in psychology, you are pretty well equipped for nothing. Sorry, no, we love you guys. You're equipped for many, many things, but you're not going to get a job as, like, a counselor somewhere. You need to have that advanced degree. So don't waste your time on that per se. I'll talk to you about career options that can set you up potentially with a psych bachelor's. But I just got a job that was flexible and fun and paid the bills. And then in that flexible time, I worked as a volunteer 10 hours a week at a lab at Berkeley and got my research experience. And I also volunteered in a clinical capacity at a substance abuse education treatment facility for people who are kind of thinking about entering treatment for addiction but weren't kind of really sure. And we did some psychoed and helped them figure out some potential resources. I also did some more clinically stuff as an undergrad. Like, I worked at Safe House as a volunteer. The domestic violence shelter in Ipsy, was a crisis counselor and a volunteer at that clinic, and did some other things around domestic violence as part of clinical opportunities to just kind of expose myself to that stuff as an undergrad. To me, what I realized in that time in San Francisco was that, like, again, I do like research. It's cool. Like, I like to think big thoughts and be like, how would I test that? And what kind of crazy experiment could I design? And I found more and more that the likelihood that I could have the patience and the wherewithal to be a full-time clinician and not burn out within 5 years was low. And there's totally individual variability. Like, I'm a very impatient person. I'm a little bit more of a control freak than I'd like to admit. And when you are a clinician, you are with someone an hour and then they leave and they have to live their life and you have no control. And then sometimes they come back and you're like, why did you do the thing we spent 1 hour talking about not doing? I love clinical work. I find it extremely fulfilling. I can do it about 1 day a week, or I'm totally burnt out. And my husband hates it because then I come home at the end of my clinical day and he says, honey, I had a bad day. And I say, I have 0 shits left to give. So that would not be good for anyone in my world. There's a lot of individual variability in that. I have friends who just find research totally draining, and like just being full-time clinicians is absolutely where their passion is. There's no risk of them burning out. They do good self-care. So there's just a spectrum. And a lot of what I'm going to like suggest to you as you leave here today is like the goal of a career like this where you're at right now is trying stuff on to see what grabs you, to see what instills passion and excitement and energy into your life. And the only way you can do that is kind of by getting your feet wet, by like getting involved in a research lab or doing some clinical volunteer opportunities to try things on and see how you feel about it. The nice thing is, as you go about doing that, it sets up your resume in a way that kind of opens doors to you. But the real thing that I suggest to people when they talk to me is like, do you love this? This is a career, especially, I would say the research, but actually both. These are careers that are driven by passion. Right, so like my friends who, like my husband went to law school, he kind of didn't know what else he wanted to do with life. Law school seems safe, good earnings, you go and you do the thing and you kind of figure out what kind of law you want to do in the middle of law school. Careers, I feel like in mental health and mental health research or mental health clinical work, you want to be thoughtful about like, can I feed the bills or whatever, or can I feed the bills, that too, but can I pay the bills, can I feed myself, but it's a career driven by passion. And for me, like, I feel like I have the best job in the entire world. I am like, could not imagine a better job for me. If you don't like it and you could, or I even say like, even if you could imagine yourself doing something else, if you're like, well, yeah, PhD in psych, or I could go get like a business degree and like open a like yoga studio or something like that, like either or, like, the advice I give is like, if it's not like, this is my burning passion and I really want to do it, then maybe try out that other thing. Like this really is a career that's like, I love this and I want to do this. I feel passionate about it. And that can feel anxiety provoking because it's not like, by the end of your junior year, you don't have like a super well-paying internship set up for like after graduation, right? That's what this career doesn't really look like. A lot of it is about getting those experiences, trying things on and seeing how you feel about it and making sure you are passionate about it and kind of hone in on what aspect of it are you most passionate about. Research, clinical work, a combo, what conditions, what disorders would you maybe want to focus on, that kind of stuff. So for me, at the end of the 2 years I took off, where I was living out in the Bay Area, that's where come on, brain. I'm trying to not drink too much coffee, and it's definitely affecting my ability to retain information. So that really set me up well for kind of knowing that I wanted to do a clinical psychology PhD program, and I wanted research and clinical. I wanted both. I wanted a combination of both as part of my career path. And so what I did at that time period after 2 years off is I then applied to like, I think 10 to 12 PhD programs. I ended up going to Yale. It was a fantastic spot for me in their clinical psychology program. I went in to be an alcohol researcher. I ended up falling in love with eating research and ended up like kind of merging my passions about addiction and then seeing how they apply to the consumption of highly processed food and overeating. So that was my area of research, and I loved it. At the end of a PhD, if you're in clinical, the next thing you do is you do kind of what looks like a medical residency year. You do it's called a pre-doctoral internship. So you apply you interview all over the nation, and people rank you and you rank them and you match, and you spend a year doing just clinical work at the end of your PhD program. Some of the programs have some research intertwined, but it's really about kind of solidifying your clinical training. In the Clinical Psych PhD, you are seeing clients throughout. You are getting yourself license eligible. You are getting trained on providing clinical care, but you're also teaching classes, taking classes, and doing research. A PhD is a research degree. And I'll talk a little bit more about what that might mean when you're trying to decide what works for you. And then I came here, and now I'm an assistant professor of psychology in the clinical science area at the University of Michigan, which is my dream job, even though it's cold. So yeah, I'm very happy about that. And I just found out that it looks like I'm going to get tenure. So woo, job for life, suckers. So that's a little bit about me. Take home points briefly. Getting yourself, don't just going in being like, oh no, I hate research. I'd never want to do it. Try and get yourself some experiences and get your hands dirty to try things on and see what they feel like experientially for you. What gives you energy? What do you leave and you can't stop thinking about? What drains you? You want to try that stuff out. If you kind of are like, maybe I'll be a PhD psychologist, or like maybe I will be, like a ballet dancer or whatever. I don't know. Like this needs to be a career that's driven by passion and that you really care deeply about. If not, like do something easier where you're in school for less time and you make more money. If that's a possible job option for you, do that. If not, if you love it, you're super passionate about it, best job ever. And I always suggest to everyone, like especially if you're thinking the PhD route, taking a year or two off after undergrad is huge, if at all possible for you. And there's a couple of reasons for that. The first is, unlike other professional programs, like you really, when you're applying to a PhD program, you are applying to a specific person. So unlike like if you're going to law school, maybe you'll like pick the top law schools and you'll just like put them in and you're like, I want to be a lawyer, right? And maybe you'll be like, maybe I want to be an environmental lawyer, or maybe I want to do whatever. But at the end of the day, you kind of specialize in what kind of law you want to get into when you're in a law school. A PhD in clinical psychology is very much like you are applying to essentially to work as an apprentice to like a specific professor. And so you really need to have a good sense of, I want to do a clinical psych PhD, but I really want to have a sense that I want to do it in depression in kids. And so I'm applying to as many people who do like depression or anxiety or something in kids. That's what I'm passionate about. So in some ways it takes a little bit more time and experience and, trying stuff out to really hone in on, I want to study eating disorders. I want to study addiction. I want to study, just disorders in children. So that's why that year or two off is both very helpful for you to really refine and make sure that you kind of are mindful about what you're applying to, and that's really what you want to apply to, because you're going to spend 5 to 6 years like totally seeped in that. Like that's going to be your life. That's what you're going to think about, read about, and it really sets you up on a career trajectory to study that thing or something related to that thing. So if you come into your PhD program and you're like been admitted to study schizophrenia, and then you're like, oh crap, actually like I don't want to study anything related to that. I really wish I was studying like autism disorders. Like in some ways that you want to have more of a sense going in. You're applying to that person. The other thing is, and we'll talk about this more, is that clinical psych PhD programs are super competitive, actually more competitive than med school. So if you are applying straight out of undergrad and you're competing against people who've had 1, 2, or 3 years out, then it's really hard. So I had that happen this year. I admitted a grad student, and I had one person who looked super solid and awesome, but was straight out of undergrad. I almost never even interview people straight out of undergrad, but I decided to. And then I had like 3 other people who had been out for anywhere ranging from 1 to 3 years. And I was interviewing them too. And just the amount of additional experiences and sophistication of research ideas and certainty about their career path for those people who'd had that additional time outside, not just straight out of undergrad. Even though that person was great, I didn't bring her on for like an in-person interview. And I told her, like, just take a couple years off. My like rock star doctoral student who's like phenomenal, is going to change the world, applied straight out of undergrad, had a 4.0, awesome test scores, got in nowhere. Took a year off, got a bunch of research experience, was a lab manager, got 16 interviews. I had to like fight tooth and nail to like get her. So long story short is like, in some ways it's nice. It takes some of the pressure off of like, by junior year, I need to know exactly and have my GREs and know exactly what PhD program I'm going to apply to. You don't. Taking that 1, 2, 3 years off and doing something that is associated with this career path. It's not like, well, I spent 3 years being a bartender in Cancun. It was awesome, and then it's like, okay, well, how did that prep you to like go into this career path? That's not helpful. But if you do something kind of like I did, or work in a lab, be a lab manager, or NIH has like a post-bac program. There's lots of different things that are related that can then set you up, and that can really open more doors for you. So highly recommend, if you can swing it, if it's possible for you, plan on kind of almost taking some gap year time. This also ensures that you're not just like, I like being in school, and school feels safe, and school, the next plan about school is more school. Like, this is your life. This is your career path. A PhD is a huge commitment. And you don't want to just be like, I just want to keep being in school forever, and that feels safer to me, right? So I've had people say to me like, oh, I'm afraid if I take time off, then I'm not going to go back. And I'm like, good. Like, that's a really good data. If the only thing keeping you going towards getting a graduate degree is the momentum of being in school, like, a crash is coming for you. Do you know? Like, that's still, that you're going to be out of school then, and then that's your career. And if you're like, oh, wait, I actually don't want to do this, like, well, there went 6 years of your life. Do you know what I mean? So taking a little bit of that time is not a bad idea. It's something I actually highly recommend. Okay. So questions that I have people think about when they're trying to figure out, okay, within the fields of what are out there of mental health career fields, how do I make this decision? So the really big question, the number one question I think I have people think about is, to what degree are you considering a career that has clinical aspects of it, where you're seeing patients, you're doing mental health care, one-on-one with patients, or developing treatment programs? And to what degree is research an option for you or a possibility for you? The other questions to fall under this. So if you're interested in clinical and like working with someone who is struggling with some mental health issues and wanting to help them feel better, is do you see yourself doing therapy, doing like the behavioral talk therapy side of things, or do you see yourself doing more medication management, like working more on the meds, the pharmacology side of things? And then with the research, it's like, do you see the research? If you're interested in research and the intellectual side of it and the sciencey part of it, are you asking questions that are about clinical issues? Or is it kind of more basic science? Like, just kind of, how does the eye work? How does the amygdala function? Those kind of more basic things, but not necessarily how does the amygdala function in the context of PTSD? That's a more clinical question. So let me pause real quick before I then lay out, like, after you answer these questions in your head, what are some of your options? This isn't exhaustive. These are things I'm most familiar with. Any questions about these questions? Okay, yeah. Yeah, teaching. Good question, too. Teaching? Teaching is something that almost comes secondary a little bit, but definitely that's a good thing to bring up. I wouldn't base your choice off of whether you want to teach or not. I will go into the teaching aspect of this from the next stage, but I'd make the decision more based on clinical versus research, and then teaching is a gradient among your additional choices. So I'll lay that out, but that's a good thing to think through. Okay, so I think of this as the spectrum. Okay, this is like, I only want to do clinical work. If you try and make me do research, I will scream. And this is like, I really love research, and I really see this as something that is really key to me, that I want to do some of the science. I want to do some of the intellectual work about this. So I think a lot of students that I talk to are really interested in, like, come to me and are just like, I totally want to be a clinician. I don't want anything to do with research. Again, I would really pause you on that, because I was totally there. I thought that was totally me. I just only want to do clinical work. Is before you totally shut that off, I think a lot of people think of like research as like, I'm sitting in like some sort of bench and like messing with like some really boring mouse peptide. I don't know, like whatever that would be. That can also be very fascinating I like animal model research quite a bit, actually. But like, whatever is the most boring thing for you, like a lot of people think research is so boring. I love research. It's so cool. And the idea, if you get involved in a research lab, isn't like, do I like what I'm doing as an RA? Because you're not. Like, it might be kind of cool, but mostly what you're doing as an undergraduate RA, research assistant, is the stuff that the graduate students and the professor don't want to do, right? Like the things, the nuts and bolts we need. Like, we need you to run participants through these protocols. We need you to like put in this data, et cetera, et cetera. The thing that you want to consider when you're involved in like a research lab is like, do the ideas grab you? It's more important to kind of be involved in a lab and like suck up, like, what are the ideas? What are the questions they're trying to answer? How are they trying to do that? Does that bring up research questions for you. Like, what kind of study would you want to design? Like, why would you want to do that? What kind of questions do you feel like you want to answer? If none of that is grabbing you and you're like, still research, like paint drying, no interest, tried it out, not for me, I'm over it. I also think if you have one bad lab experience, like, don't draw the line at that. Like, switch to a lab that might be more in your interest. I've talked to so many people who've like been in a lab and they were doing something and they hated it and they were just like, I know I don't want to do research. And it's like, no, you don't want to do research in that lab. Like, that lab's ideas didn't grab you. But there might be other labs out there where it does grab you. Because I think this for me is a big question, that if you know that research is not in your wheelhouse at all, I would really highly suggest not doing a PhD. Because again, the PhD is a research career. It is about doing research where you get a master's and a doctorate level and you're doing science, and you have to do that science and defend that science. And if you hate science and research, that is a long time, 5 years, to be doing something that you have zero interest in, right? So what I do recommend, if you're like, absolutely, research is 100% off the table for me, a master's of social work is the largest growing mental health career profession that's being hired out there. Like, an example I always give is, I was at the VA, they got a boatload of money from the government, and they said, okay, there's no evidence out there that if somebody has a master's in social work versus a PhD in clinical psychology, outcomes, as long as somebody is using a scientifically informed treatment, does not differ. PhD level people do not provide better care than people who have a master's in social work. As long as you're, not like, somebody with a PhD can be like, oh, we're doing like blanket rebirthing therapy, like, and just, whatever crap like they came up with in their head. Like, it doesn't matter whether you have that master's in social work or that PhD, really, and the clinical outcomes. That's what the research suggests. And because of that, if you have a bunch of veterans who need care, who are you going to hire? The PhD or the master's of social work? Now, the downside is that the earning potential of a master's in social work is lower than a PhD. It is like about $65,000 versus like $80,000 or so on average. You should double check those numbers. It's been a while since I like totally confirmed them, but like they're somewhere in that ballpark. But as a master's of social work, you're in school for 2 years and then you're out the door and you're like doing work, right? Versus the PhD where it's 5 or 6 years. Master's of psychology is like a lesser known degree. It exists. I'm not as familiar with it. I think typically unless there was a really solid reason to do the Master's of Psychology over the Master's of Social Work, the Master's of Social Work is the one that's more common. You can get licensed, you can hang out a shingle, you can see individual patients, you can work at the VA, you can do all the clinical stuff that a clinical psych PhD person does with a Master's of Social Work. Masters of Psychology, there's very few states where you can actually get licensed and see patients with only a Master's of Psychology. And that's also, I think in Michigan, where we even do provide some licensure, I think you have to pay and be under the supervision of a full PhD level psychologist for like your entire career. So Masters of Psychology maybe, but like not something I would think Masters of Social Work first. MD is also a very clinically focused career. If you want to go to med school and be an MD, like the big focus is on like seeing patients, not doing research. You're not getting trained on doing like clinical work. You're not getting trained on like how do you do studies, how do you do science. So if you're just very interested in clinical work, an MD is a possibility with a psychiatry focus. The downside about the MD is that it you're gonna make a lot of money, so woo on that. But if you were like your heart is set on doing the therapy, like every week you're meeting with the people and you're like talking in your office, MDs don't really do that as much. That's not where the insurance reimbursement for them is. And so they do a lot more medication management, and we'll meet with somebody kind of more regularly to get their meds stabilized, which can have a huge impact on improving mental health. But once the meds are stabilized, they'll just kind of see them more for check-ins and do less of the like behavioral therapeutic work that a psychologist or a master's of social work might do. So if you're like, I want to do clinical work and I want to help people with mental health, and like pharmacology and drugs and helping sort that out is a possibility, MD is a good option. And then PsyD is the one that I really highly put warnings around. PsyDs have kind of popped up because a lot of people do want, the doctoral level training in psychology, but are not interested at all in research. And so this whole kind of money-making scheme, in some ways, this professional degree in psychology popped up around that, where schools, like professional schools, popped up and said, we'll give you a doctorate in psychology. Some of them have been accredited by the American Psychological Association. You're going to do minimal research. We're mostly going to focus on clinical work. The problem is that you get charged about anywhere from 20 to 30 grand a year. Over a 5 to 6 year period, you come out with an insane amount of debt. Your earning potential is pretty much the same as somebody with a master's of social work. So even though, yay, this is the one that like people call me doctor, but I'm massively in debt. And like, I don't make any more money than my friend who has a master's in social work. So there are some PsyD programs out there that are somewhat are affiliated with actual universities. A lot of people, when there was like a huge glut of PsyDs, like people would just buy a building and we're like, we're the Professional School of Pacific Psychology, like whatever the hell that means. And then they would like admit classes of like 100 people. So they made a ton of money and just were pumping out these PsyDs. So it's a kind of considered a secondary, less well-respected degree option. So that's my big asterisk about it. I would only consider it if you went somewhere that was affiliated with an established university, accredited by the APA, and you got significant financial aid. The other thing to look at is to make sure that internship I was talking about, PsyDs go on that same internship pool that I did as a clinical psych PhD, where like I rank programs and they rank me, and I have to have that year of clinical pre-doctoral internship to get licensed. A lot of PsyDs, I think the situation's getting better. For a very long time, there were far fewer openings than there were students. And so a lot of people were going through these PsyD programs, coming out with 6 figures worth of debt, and then couldn't match anywhere on internship, and so couldn't get licensed. It was just totally horrible. So I think some of this situation has improved, but with this PsyD, like unless you have like money to burn, like buyer be very wary. Okay, middle of the road. So you kind of want both, right? And both, there's many ways to think about that. So some clinical psych PhD programs are, let me actually start on this end and then we'll move backwards. So what if you're like, I really love research, man. Like I love research, it's awesome. A lot of the top clinical PhD programs are actually closer to this end of the spectrum, so are more researchy. Yale, the Michigan, UCLA, USC, like the top 25 are all what we call more clinical science programs. And we think of ourselves as scientists who then have practical clinical applications to what we do. And that you do get trained, you are seeing clients, it's very scientifically focused. The treatments you're getting trained in all have to have scientific support. You are doing a lot of research. You're typically spending about 8 to 10 hours a week doing clinical care, but most of what you're doing is like doing clinically focused research. Now, does that mean you come out of it, like 100% of the people who come out of Michigan or Yale end up being like professors? No, it does not. Like I would still say, you kind of get in. And as I talked to you, there's only so much you can do to try and get a vibe for like, how much do I love clinical work? How much do I love research? Like I knew research was on the table for me and there was a good chance that where my career was going to go. But then when I got in there, like I felt totally certain that I could only do clinical work 1 day a week. And I felt totally sure I wanted to be like research to be the dominant part of what I did. Other people I've known who've done like researchy stuff their whole undergraduate career and came in saying, I'm going to be a researcher. I'm going to be a professor. I want my own lab. Totally ended up hating the research and are like awesome full-time clinicians. So even if you go to like a University of Michigan or a Yale or somewhere like that, that's very researchy focused, you can still end up in a like full-time clinical career. However, if you're like, I know I don't want to do research, it is kind of torture to be in a place that really wants you to be a research scientist, and that's what the focus is, and that's kind of what you're being evaluated on, and that's what a lot of your training is. If you like just totally don't want to do that and you hate it and you know it from the get-go. So if you, again, like if you just know that research is off the table for you and there's no way you want research to be any part of your career, like don't consider these like top clinical psych psychology PhD programs. That's what we're really looking for too in our admissions, like people who want to be research scientists that are clinically focused. And then if you're totally even more like, I just love research and I do not want to sit in a room with a patient, like I do not really, I'm not clinically focused, then programs that are more of the basic science PhDs are better options. So developmental, you can get a degree in developmental psychology, you can get a PhD in biopsychology, you can get a PhD in cognitive psychology. They don't have any training around clinical work or seeing patients. They take way less classes than we do in clinical because APA requires us to take a lot more classes if you're seeing patients. So broadly, if you're just like, I don't want clinical work at all, then one of those PhD programs is a better fit. And you can understand some of the phenomena you might be interested in, but the clinical piece is off the table for you. Okay, in the middle here are some clinical PhD programs, psych PhD programs. I'm going to give you guys some resources at the end. There's this book that if you're interested, it's the Insider's Guide to Clinical and Counseling PhD Programs. And it lists pretty much every PhD program, I believe, that's accredited by the APA in this one book. And it tells you everything about like that program and how many people applied and how many people got admitted and what are the faculty research. And it also gives a rating from like 0 to 10, or I think 1 to 10, of how clinical they are versus how researchy they are. So like a Michigan, like 8 is super researchy, let me just say off the top of my head, or it's like 1 to 8. Like Michigan's an 8, Yale's an 8. There actually aren't, PsyD programs would be like a 1 or a 2, like not researchy at all. There are some programs in there that are more like a 4 or a 5, where it's like, okay, kind of more of a 50-50 between clinical and research. Places, these are actually kind of harder to find than you would expect. And so some of those that I know exist out there is like Bowling Green, Eastern Michigan. They're more balanced. I want to say Auburn has a more balanced between clinical and research program. Again, even if you go to a super researchy Michigan or Yale, you are still set up and licensed and well-trained to be a practicing mental health full-time clinician, but most of your training is focused on the science. So this is a possibility if you're really like, I'm willing to consider research. I don't despise it. Maybe I'll fall in love with it. But I'm like 85% sure that like really what I want to do is more like be a full-time clinician. Those more middle of the road programs might be a better fit for you. That book should give you some guidance about what those programs are. But again, there's a lot of them and there's not a lot of them. There's a lot of students who are maybe in that boat, but it's just something to think about. MD, PhD, if you're somebody who's really into the pharmacology, but you also want to do a lot of research, you want to do clinical care, you're interested in meds, there's opportunities to do all the schooling, which is MD, PhD programs. I don't know a ton about that, but some of the smartest people I know are MD, PhDs, and they were in school forever, and they do really cool clinical, psychological research, but also see people in more of a medical capacity, medicine management capacity. PhDs in social work are not something I'm totally super familiar with. Also, PhD in counseling psychology are 2 degrees that I'm not super familiar with, but I wanted to put them out there. The PhD in social work, I believe, often has more of a clinical bent to it, but it also trains you to do research. So if you kind of want want both. PhD in counseling psychology, I'm not super familiar with that career path, but I do know it's an option where you're seeing clients, but it's more like CAPS, like it's a little bit less, maybe some adjustment issues, lower level mental health concerns. You're maybe not seeing as much of the severe psychopathology that you might in the context of a master's of social work or clinical psych PhD. But those are options to consider and do some research about. Neuropsychology is a subsection, a subspecialty within clinical psych PhDs. This is kind of the thing that psychologists like do that nobody else does, which is do testing to try and figure out like, was there a stroke? What's the neurological functioning? Does somebody have ADHD? Do they have a learning disability? What's their function after a traumatic car accident? I have colleagues who do this. It definitely is kind of more of a clinical focused bent because you're seeing patients and and you're doing testing and you're really kind of getting their neuropsych profiles by administering all these tests. It's kind of Sherlocky to me. I like did a little bit of it as part of my internship. I thought I was going to hate it. It was actually really interesting to be like, here's all the tests and here's all the data and like what's actually going on with this person's brain. Neuropsychology PhDs are kind of a combo, I would say, of both kind of being researchy, but also, you know, a lot of people in neuropsych end up seeing a lot of clients as well. So there's also other options in here I don't have. I know that there's like psychiatric nursing as an option. I don't have a lot of familiarity with that, but I've heard from some people who go on to be like medical practitioners, nurse practitioners, and then specialize in psychiatric care. I'm trying to think of it. Is there anyone on here that you thought you would see that I didn't talk about that I might be missing? Yeah. Yeah, physicians. So like a PA, a nurse practitioner, that's a little bit more in the spectrum of the MD world. And you can specialize specifically in psychiatric kind of PA or psychiatric nurse practitioner. So again, you're not doing as much of the like talk therapy, like all those of you, who's in my class, like 270? Okay, a lot of people are. Okay, so like you're not doing as much of like CBT or the actual talk therapy sides of thing, the behavioral therapy. You're doing more medication management and then like kind of checking in with people about their life. The best teams are people where a nurse practitioner or a psychiatrist is then working on a team with somebody who's a psychologist in the context of when somebody needs both. You know what I mean? But you're not actually typically providing, you're not seeing somebody every week working on that. So if you're cool with like I want to get in and I want to help you get the medication you need to help yourself manage better, like that is certainly a career path option. Absolutely. Other ones, yeah. Not that I'm super familiar with. So like it is often seen that it's mostly focused at the PhD level. So there is that master's in psychology where you can have a clinical focus or a neuropsyche kind of focus. But it's usually, we usually don't expect people, it's possible, but not typical to get a terminal master's degree and then apply for your PhD in clinical psychology or with the neuropsych specialty. Usually what you do is you get your master's along the way. So I got like a master's in my second year and then a master's of philosophy, master's psych in my second year, master's philosophy in my third year, and then the PhD. So I try and get my husband to call me master doctor. He won't do it. But the terminal degree, it doesn't necessarily help you. One cool thing we do have at the University of Michigan is this accelerated degree program where you can stay for a fifth year and you can get a master's degree in that fifth year. This is only if somebody is like already working in a lab and has a mentor who's willing to take them on for an additional year to do a master's thesis. But it's it's pretty expensive. But I think especially for people whose GPAs are not quite where they need to be competitive for a PhD program, that accelerated degree program can be a good option and can get you more like, okay, or other people who have that and are just not really sure they want to commit to like a PhD, that's a possibility, but a terminal master's and those things are less helpful if you're thinking PhD. Yeah, question here. I don't believe so. So the question is, if for a master's of social work, do you have to, is it like the master's of psychology where you're always under? I don't think that you do. That's not been my understanding of working. Some of the best therapists I know are masters of social work. They're extraordinarily good. I think you can get fully licensed and then kind of be doing that. That's why I'm like, the masters of psych to me always just feels like a little weird. Where the masters of social work, in addition to kind of doing individual therapy, you can also be doing kind of program management and like, you know, children welfare. There's a variety of things you can do with that. Yeah, question here. Yeah, occupational therapy. That is not one I am familiar with, but it would certainly be an option. So you wouldn't probably be doing like the traditional, like, oh, you know, let's work on your depression symptoms, but you could really, occupational therapy does play a huge role on a mental health team, especially with severe mental illness or in the context of learning disabilities or with children. So that's also a path that I'm not familiar with, but would definitely be one worth exploring. Question here? That's a great question. Let me see what my next slide looks like and whether I start to lay this out. So PsyD programs, okay, disclaimer, there's lots of variability. Things are always changing. Counseling psychology, as I talked about, is an option, not one I know much about. School psychologist as well. Not something I know a lot about, but also you're going into schools, seeing kids who are maybe struggling, doing a lot of testing. That is not an area I know a lot about, but also if you're trying to consider mental health careers, that's an option. Let me give you this. Okay, clinical psych PhD programs. So PsyD programs, because you are paying them, they'll admit a bunch of people. It's pretty easy to get into a PsyD program, and that's part of the reason the degree is less well respected. PhD programs are typically fully funded, so you come out with no debt. My graduate students actually get paid a stipend to live off of, and they teach. So they pay no tuition, they have health insurance, and they have a stipend to live on, and they teach as part. Going back to the teaching idea, MD has less teaching responsibilities. PhD teaching's typically a part of what we do. And you are set, and there's variability in what kind of career. Like, I teach a decent amount. I teach about 3 classes a year. You can go to a liberal arts college or a teaching college where you're teaching like 5 to 6 classes a year. There you're not doing much research. You're doing a lot of teaching. I'd say of my PhD students right now, 1 is probably going to be a me and mostly do research and teach some classes. 1 is going to be mostly a clinician and do some research at a VA hospital. And my other PhD program, I would say, is probably moving towards a liberal arts college because she loves teaching so much. She's one of your GSIs. And wants to teach, a lot of classes and probably have a small amount of research on the side. So when you have that clinical psych PhD, you can kind of cobble together what kind of career path you want. What my career path is missing is time carved out to see patients. Once I got licensed, it isn't part of my job description. So once I pop this baby out and get used to being a mom, I'll start seeing patients again on the side. So clinical psych PhD programs, 1 to 5% acceptance rate, pretty darn low acceptance rates. They're pretty competitive, and that's another part of that reason. Usually I would say a GPA of 3.5 or above is almost absolutely necessary. So really focusing on getting your GPA nice and high is really helpful. I would say really to be competitive, a 3... I would take it back. 3.5 or above, you've totally got a shot. You should totally apply. You can feel like much safer if you're like a 3.7 or above for those top programs. Yeah, question here. Yes, absolutely. So the question is, do you see people just not getting into programs at all? Yes. One of my prior undergrads applied to a ton of programs, didn't get in anywhere. It's actually kind of pretty common, actually, because of the low acceptance rates. A lot of them, that one, I'm not sure what she's up to. I know some who've applied to my lab, some who's actually gone and gotten a master's of public health. That you can do like more the program and the policy side of things, which is really relevant. I've seen them go on to do a master's of social work or a PhD in social work. I've seen them do things like occupational therapy, like lots of different things. You can definitely be competitive, but I also suggest to people like applying to about between 10 to 15 programs because of this low acceptance rate. So people don't get in, but there's other paths then to like consider. And so some people actually suggest, why don't you throw a couple masters of social? One of my undergrads who's fantastic, didn't get into any PhD programs, but did get into a master's of social work program at Columbia and just totally is in love with it. It was an awesome fit for her. So you want to kind of have a variety of options available to you. Yeah, question here. Mm-hmm. Absolutely. So the question is, do programs value taking time off and doing research? Absolutely. That's, to me, one of the biggest discriminating factors of who's competitive and who's not. So if you are thinking that PhD because of the level of its competitiveness, let me just mosey through this and I'll take some questions. Top programs are all about the research and also getting that additional research afterwards really helps, and the fit with the mentor. The letter, so you write a letter where you're essentially writing a love letter to like a specific professor, and you're like, oh my God, I love you and I love your research and you're who I want to work with and here's all the reasons why, right? And I'm a perfect fit for you. It's a lot of it, I'll have fabulous people who have great GPAs and great GREs, but like they weren't a good research interest fit, that's a problem. That's another part of the reason taking some of that time off and feeling confident that, like, yes, this is what I want to study, helps you write letters that are more compelling. High GPA, as I talked about, I think in my mind, the high GPA is like an absolute important thing. A master's of psychology can be useful if your undergrad GPA is maybe not where you wanted it to be, and a master's in psych might help you get a bump in that, but not always. So it's a maybe that would help. But GRE scores are weighted differently at different universities. I mostly look at them to make sure somebody didn't like fully bomb the GRE. I kind of think the GRE sucks, but I know some people who like they won't look at people unless they have like all their GRE scores are like in the 80th percentile or not, or in the top. So GRE scores are important. Research experience, if you're going to those top clinical psych programs, even the more middle ones, is a must. Having some sort of research experience. Taking some time off can really help. Your letters of rec are really important. So working in labs, getting to know professors. Like, I don't write letters of rec out of Psych 270 because I just can't write you a good letter, right? This person stayed awake during lecture, occasionally asked question. Like, that's not going to get you into grad school. It needs to be like you work with them and they know you. That's another good thing about taking that time off is you can work in a lab, get to know you. Professors can then like write you a solid letter being like, yes, this person's going to be awesome in a PhD program. You still need to be interested clinically. If you go into a clinical psych PhD program and you're like, ugh, patients, ick, like dead in the water, like you need to be interested and be willing to sit in with clients. We need to talk to you and make sure like you have the social skills, like basic social skills to be able to talk to clients. You're kind of a jack of all trades, right? I can teach, I can do clinical work, I can do research. That's what makes the clinical psych PhD like so like darn tempting, is it's like I want to do everything. And then how you cobble that together, there's so many different career paths out of a clinical psych PhD, whether you're in a psychology department that's very research focused or a psychology department that's very teaching focused, a liberal arts college. A psychiatry department is like half psychologist, half psychiatrist. My colleagues over in the med school, they see a lot more clients. They don't do any teaching and they do research. So there's also, or you can just hang out a shingle or work at a practice and be a full-time clinician, right? There's so many different pathways within the clinical psych PhD. It takes about 5 to 7 years, depending on how long your dissertation takes. And then you do that internship that I talked about. That's a must. So that kind of gives you a vibe for what the clinical psych PhD is. Again, research experience is a must. High GPA super helps you. GREs, like, do your best. Don't like kill yourself if they weren't perfect. I don't remember what mine were. They were fine, but they weren't like, oh my goodness, like 99 percentile. I don't know. GRE's stupid, I think. You want strong letters of rec. You really want to know what your research fit wants to be, why you're applying to this person, why they are your match. So those are those questions. So I'm going to like pause and start taking questions around the room. I know we're going to go over time. Hopefully nobody like needs this room for the next hot little bit, and I'll just take questions. So let's start here, and I'll just work way across the room. Great question. Absolutely. Great question. So are the Masters of Social Work as competitive as clinical psych PhDs? Not at all. But they're a very well-respected degree, unlike the PsyD programs. They are, which have, kind of newer degrees. People are a little more skeptical of them. Masters of Social Work, because you are paying, the big thing that kind of constrains us in the context of a clinical psych PhD is we are paying for you. So you're super expensive. So our cohort size of like people coming in for the clinical area to do a PhD is anywhere between 2 to 6 students. Masters of Social Work, it can be like, I'm not exactly sure off the top of my head, but I think somewhere around like 50 or 60 students in an incoming cohort. So it's not that students are worse or anything, it's just there's more slots available. But since you're only in school for like 2 years, like you don't come out with like 6 figures worth of debt. And I know here, like if you're interested in social work, U of M I think has the #1 social work program in the US. Like go talk to them. Like they'll be able to give you better detailed information. I don't know. I don't think the research stuff is weighted nearly as heavily, but getting some clinical experience and showing that you're interested in that domain would be helpful, I would imagine. But I would go over to the social work and try and sit down with like their version of student academic affairs and just learn a little bit more about that. But no, it's definitely not, it's far less restrictive Yeah, great question. Yeah, here. Mm-hmm. Oh, question. Got you. So if you want to get an MD, like as an undergrad or as being a psych major, like is that going to help you, or is it kind of like, oh, you should do another one? I think it does help you. I know a lot of my students who've gone on to do MDs do psychology as their undergrad. Things to potentially consider is our BCN degree that has a little bit more of the bio focus to it, and that can help show that like I'm going to get into anatomy and I'm not going to bulk at it. So I would consider BCN or psychology are two very good undergraduate degrees to set you up for med school. Maybe BCN, I don't know how true this is. I would maybe do BCN slightly above. BCN didn't exist when I was an undergrad here, but BCN might set you up slightly better. But I don't think like massively quantitatively better. Does that help? Okay. I don't know a ton. The question is, like, are there specific psych classes you should take that will set you up for med school? I don't think so. I'm not super familiar with the med school, but I think like the med school admissions. But I do think they are looking for certain things like organic chemistry and like those kind of things. I think they are typically looking for that you don't typically get in your psychology undergraduate degree. So in some ways it might be safer to do the typical like BCN or, you know, whatever major, and then like also show that you've taken some psych classes, because in the context of med school, you would get the general med school training, and then in your residency years is when you would focus your specialty into psychiatry. But before that, you're doing the liver and the spleen and the heart just like everybody else. So you kind of, I think, need to show that you're comfortable with that, which BCN or some of those more traditional majors might set you up to have a clearer story about. But I'm not super med schooly, so like I can't tell you for sure. So I would double check with someone else, but like and let me put this up for people who need to leave, the like resources I would suggest. Boop, boop, boop. Okay. Here are resources. I would strongly suggest that a student's perspective, these are things you can Google and are just free. A student's perspective on applying to graduate school in clinical psychology, a step-by-step guide. This is something else you can Google that's free. Mitch's uncensored advice for applying to graduate school in clinical child and adolescent psychology. And the book, The Insider's Guide to Graduate Programs in Clinical and Counseling Psychology. This is also, I know they have this in Psych SAA. So you could just stop by the Student Academic Affairs office and like ask to take a look at it. But if you're applying, buy this for yourself. It changes every year, so you'd want to apply, buy it about the years you were doing it. These are really good resources to Google, and that like, how do I know which one I want to do? What kind of career I might want to do? So those resources are key. I'm going to pop around a little bit. Let's do a question here. Mm-hmm. Yeah. So like an actual like psychiatric institute, with a bachelor's, there's not a ton of options. There might be, it would mostly probably be volunteering to get like a vibe for it when you are at this level. After that, any of those degrees that I've showed, Master's of Social Work, Clinical Psych PhD, Nurse Practitioner, MD, like all of those are available at... No, you could totally have any of those degrees I talked about if you wanted to work at like an inpatient psychiatric institute, any of those guys. Counseling psychology, not so much. Neuropsychology, you still would. MDs, PhDs, all that kind of stuff. Yeah, you got it. I'll do a question here. I've got a lot of questions for you, so I'll come back to you. Yeah, go ahead. Oh, yeah, I believe that's a counseling degree. So there's a marriage and family therapy degree I believe that is typically a master's in counseling, and then it's a subtype. So that's something else. I don't know a ton about counseling programs, but they're more that like adjustment-y kind of stuff, and less like you have a severe mental illness. But I believe that's within the realm of a master's in counseling or a PhD in counseling.